Kabale District Health Team, in collaboration with the United States Agency for International Development (USAID), have launched a campaign aimed at engaging journalists to boost public awareness about Mpox virus. Since the outbreak began in July 2024, Uganda has confirmed 11 cases with no fatalities, and the outbreak was first detected in the Democratic Republic of Congo. Dr. Alfred Besigensi, the Kabale District Health Educator, outlined its symptoms and signs being skin rashes, fever, sore throat, and highlighted some of the categories at high risk of contracting the disease.
Spread by contact. When you get in contact with an infected person, especially with fluids that come from that contact person, or through kissing, or you get in contact with things that are contaminated with body fluids of an infected person, like bed sheets, or an infected pregnant woman can also pass it, the unborn baby, or if you inhale any contaminated air particles, then all the viruses, you can easily get it. Or when you get in contact with animals that are infected. As you are all aware, this is a zoonotic animal, a zoonotic disease. The disease has been in animals but can cross from animals to humans. So if you are, especially those who go to hunt in forests and get in contact with an animal that is either has died of the disease or it is sick of that disease, you can easily get it. Is it okay? So what are the signs and symptoms? They are generally signs that are common with like any other disease. But the most prominent ones is a skin rash. For all of you, you have seen cases with prominent skin rash. We also get fever. We also get sore throat, headache, back pain. They get body weakness, swollen lymph nodes, and sometimes body aches. If you have multiple sexual partners, then you are always in contact with people. Some of those may be having the disease, and therefore you are at a very high risk of acquiring the infection. Then also, we see people who go for hunting in these game parks. They are at a very high risk, because even though some people who are the others who are very at risk, who are in business, those who are moving in those areas where we have many cases, and therefore we encourage people to really try avoid movement.
During a press conference held at the Kabale District Headquarters, Dr. Gilbert Mateeka, the Kabale District Health Officer, underscored the importance of involving journalists in the campaign. They believe that the media engagement will help disseminate vital information to the public quickly, aiding in the prevention of Mpox transmission.
Basically, for the sake of creating awareness on monkeypox, which we now call Mpox. I think we are all aware that in July 2022, the World Health Organization declared Mpox a public health emergency, something a public health concern. And in Uganda, recently, that was on 24th July, we had the first case in Kigezi. To date, we have had cumulative of 11 cases across the country. Thank God there's no death. There are no more new cases in the country, but Kabale District, by the nature of its location, we are located in southwestern Uganda, Kigezi region, and we interact closely with the emerging epicenter in the North Kivu in DRC. So that puts us among the districts or the regions that should be prepared. And that's why we are gathering, we are inviting you as the media people that you help us to start creating awareness, because it is very key that the community is this disease, how is it spread, who is likely to have this disease, how does it look like, and what are the risks, it puts on the people who acquire it. So we are meeting here and want to engage you as media people to see that we start together, because you are very critical. It comes what the community knows, you play a very big role.
Kigezi districts are partly vulnerable due to their frequent cross-border interaction with neighboring countries like the Democratic Republic of Congo, where Mpox is thought to have originated from. In Watahu, the Assistant Resident District Commissioner of Kabale issued a stern warning that anyone found obstructing efforts to curb the spread of Mpox will face legal consequences.
Talk to the masses about the outbreak. Let it not be politicized, as you have said in your briefing. Another thing we are saying, let us be compliant. If you find yourself with a disease, go to the nearest health center, report the case, let it be attended to by the people in charge of the health center. Thirdly, we are seeking for cooperation. There is nothing that can happen when you don't cooperate. Therefore, the media and the officials within the district plus the community, let us cooperate, let us know where the suspects are, we report them to the nearest or to the officials in charge. As the security, we are here to assure you that we shall work with you hand in hand to see our population protected against the outbreak. Another, you write anything because we are looking for favors from this politician. The government is working closely with you. Anyone to saboteur this thing, we shall arrest you. Thank you very much.
Mpox is a contagious disease caused by the monkeypox virus and spreads through direct contact with an infected person via touch, kissing, or sexual activity. It can also be transmitted from animals during hunting, skinning, or cooking, and through contaminated materials such as bedding, clothing, or needles. Additionally, pregnant women can pass the virus to their unborn children. Samuel Muza, ABK Television.